Did you know this common antibiotic can tear your tendons, even if you've taken it safely before? Most people never hear this warning until it's too late. Hey, I'm Lucy, a hospital clinical pharmacist. I work behind the scenes helping doctors and nurses choose safe medications and prevent medication-related harm. Today, we are breaking down ciprofloxacin, also called cipro, a common antibiotic that can save your life, but also has serious risks that most people don't know about. Stick around, I will tell you the one thing you must never ignore while taking it, plus tips to stay safe. Ciprofloxacin belongs to a class called fluoroquinolones. It's often prescribed for infections like UTIs, certain lung infections, and some hospital-acquired infections. It works by killing bacteria, but it doesn't touch viruses. So if you're taking it for a cold or flu, it won't help. It's strong and effective, but in recent years, doctors are using it less for simple infections because of its risk profile. In the hospital, we sometimes reserve ciprofloxacin for patients with resistant infections because safer antibiotics exist for routine cases. Now, let's talk about the side effects. Mild side effects are common, but usually manageable, such as nausea, diarrhea, upset stomach, dizziness, and headache. The mild side effects are usually not dangerous and improve over time. But the biggest red flag is tendon pain or swelling, especially in the Achilles tendon. This is one thing you must never ignore. Ignoring tendon pain can lead to tendon rupture, which might require surgery and months of recovery. Other serious side effects include peripheral neuropathy, which can manifest as tingling in hands and feet. You can have mood changes such as anxiety, confusion, agitation, or problem sleeping. Some people might experience severe diarrhea, especially with fever or stomach pain, which could be a sign of C. diff infection. And also, you might experience heart rhythm changes. I've seen a patient who felt a small twinge in their Achilles and ignored it. Within days, the tendon was severely injured. That's why it's so critical to act immediately. Side effects are more likely if you are over age of 60, take steroids medication like prednisone, have kidney problems, or have history of tendon issue. Now let's talk about drug interactions. Cipro interacts with calcium, magnesium, iron, and antacids, which make it less effective. Always take Cipro 2 hours before or 4 to 6 hours after these supplements or dairy products like milk or cheese. Some heart medications, blood thinners, and diabetes medication require close monitoring. If you take multiple medications, make a chart or use a pill organizer to separate them properly. It can prevent serious complications. Some tips to help you take Cipro safely is drink plenty of water while taking it to help your kidneys process it. Avoid intense physical activity if you start feeling tendon pain. This reduces the risk of rupture. Never double the dose if you forget to take the pill or stop early without consulting your provider because both can cause problems. In the hospital, we always weigh the benefit versus the risk, and we monitor patients closely for side effects. At home, you can do the same by reporting side effects early and following instructions carefully. A provider once called me about a patient who had been discharged on Cipro. The patient was experiencing mild bicep pain with no known injury. I advised stopping the medication and switching to another antibiotic. Early action prevented a serious injury. So, when should you call your doctor if you're taking Cipro? You should call your doctor immediately if you notice tendon pain or swelling, tingling in the hands or feet, severe diarrhea, rash, or mood changes. Even mild symptoms like slight ache in your biceps shouldn't be ignored. Remember, tendon pain is one thing you must never ignore. It's your body's ways of saying stop. Ciprofloxacin can save lives, but it comes with risk. The one thing you must never ignore is tendon pain or swelling. If that happens, contact your doctor immediately. If this video helped you, Hit like and subscribe for more tips from a hospital clinical pharmacist. And tell me in the comments, have you ever taken Cipro? And did your doctor warn you about the risk? Thank you for watching. Until next time, stay healthy. And remember, health is the greatest wealth.